Hi, Michael. How are you?
Hi, Joe. How are you today?
I'm good.
Great.
Good. Sorry, my boys decided to come in right as I was logging in. That's how it always happens. Oh, I'm trying to put off nap time.
Oh, yeah. That's the first time I use this feature on my laptop, so I'm glad it appears to be working and sounds fine. So good. I'm glad.
And sounds good on, coming from you too. So
okay.
Awesome. Cool.
Great.
I am going to mute and go off video and go get them settled, and then I'll be back. Steven should be on in a minute too. So,
okay. Sounds good. Thank you.
Go ahead and get started. I want to welcome everybody to this inaugural kickoff meeting of what we're calling the Top 6% Home Care CEO Mastermind Group. And I'm sure you're wondering, where did you get this top 6% thing? And I think I may have said in one of the articles or the emails, our very first mastermind group we started in 2013 originally was called the $5 Million Mastermind Group. And then as it grew and grew and grew, and as we got more information on benchmarking data from the industry, we realized that that group was clustered around the 95th percentile in revenue, and so we named it the Top 5% Group. We formed a couple of other groups, and one of them was clustered around the 90th percentile, and so we named that the Top 10% Group. And then we had more people interested, and they were in between, so we named that group the Top 7% Group. And now we've got a group of folks who are really about the same size range as our 5% group. So we're shoehorning, is that a word? Shoehorning this group in between 5% and 7%. So that's how we got the name, the Top 6% Group. And this is quite an interesting opportunity because several of you are running home care companies that are affiliated with either a home health agency or a hospital system or a social service agency. And several of you have some private equity and you're doing some growth through acquisition. And so I think this is going to be quite an interesting group to pull together. I mentioned we have 4 mastermind groups running now, and so we'll follow that same model unless as a group you decide you want to do it a little differently. But typically our groups meet twice a year face-to-face at a time and a location that the group decides. And typically the in-person meetings fall into one of 3 categories. One is we go to a city where a member is, and oftentimes they sort of host us, and perhaps we get to see their facility. Sometimes we go to a city of another mastermind member in one of our larger groups. I've never heard that on my phone before. Sorry about that. Sometimes we go to visit one of the larger groups, and they host us. And then sometimes our meetings, the group decides they want to bump their meeting up against another event. So for example, we have 2 different groups that are meeting on the front or the back end of the Home Care Association of America conference in Tucson in September. So you'll have an opportunity to look at dates, look at locations, think about where you'd like to go. And then the agenda of those meetings is put together based on input from the group, things you would like to talk about. Typically, we find that the major agenda items fall into one of three major categories. Issues related to sales, marketing, and business growth, issues related to caregiver recruiting and retention and staffing, issues related to operations, systems, software, those kinds of things. We also have some conversations around industry trends, such as the Medicare Advantage opportunity, mergers and acquisitions, those kinds of bigger, broader trends. And so again, you will have the opportunity to identify the topics that you want to discuss. Then we typically meet once a month for about an hour or 90 minutes using this Zoom video platform, and we typically have a single topic for each monthly meeting, one thing that the group wants to talk about. And sometimes we go around the group and each person shares on that topic. Sometimes one member of the group will present and lead the discussion on that topic. Sometimes I will present on that topic based on research that we've done at Leading Home Care, or sometimes we'll have an outside guest to come and present on that topic. So that's sort of the format. As I said, the group is arranged by size, and so this group is $10 million and up. We said 10 to 20. Some of you may be a little larger than that. We have no competitors in the same market. And as we have gotten bigger groups and people growing through acquisition, that has become a bit of a tricky situation. And in fact, Carrie is with us because she's a member of another group, and one of those members of that group expanded through an acquisition, and that was going to create a competitive situation. And we talked it through, and I mentioned to Carrie that this group was a possibility, and she helped move the momentum forward to organize this group. And as a result of that, we developed a policy that basically says, when you're in a group, and if you grow through acquisition, and that acquisition moves into the territory of another member of the group, then you've elected to do that, therefore you have to leave the group. So far, we haven't had that happen. We'll wait and see what happens with this group and the other group. But that was the sort of the policy that we developed as a result of that initial situation. Anybody have any questions about the group and the concept and what we're putting together here? Okay, well then what I'd like to do is just go around the room and give everyone here an opportunity to tell us a little bit about you and your company and how big you are. And some of you are affiliated with other organizations. Some of you have multiple locations. Just tell us a little bit about your organization and what you think you might bring to the group. And because it's Hollywood Squares, I'm just going to start in the upper left-hand corner of my screen, and Michael Nappy's up there. So would you go ahead and tell us a little bit about you and your agency, Michael?
Okay, thank you, Stephen. So I'm Michael Nappy. I'm based out of Connecticut, Central Connecticut. We are owned by a larger health system called Hartford Healthcare. Historically, we were always part of, I think, Stephen, you did some work a couple of years ago with Independence at Home. So we've had a lot of change since then. Historically, we were part of the certified organization, our certified home care, where I believe as of now, we just had a recent acquisition. And after that acquisition, our certified home care is probably the largest certified home care in the state of Connecticut. But we've had significant growth year over year for the last 3 years. So our health system decided to break us out into our own business unit within our post-acute or community network division. So we, in terms of our size, we span the entire state of Connecticut. There's 169 towns in Connecticut. We serve about 80% of them, with the exception of Lower Fairfield County, which is kind of right out, right north of New York City. We have about 65 live-ins, and we do about 25,000 hours of PCA and homemaking hours on a monthly basis. We've been experiencing about 15% year-over-year growth. The market in the small state of Connecticut is very large. As of today, there's 710 private duty agencies just within Connecticut alone. So that averages out about four per town. Let's see. So I think that as a general overview, that sums up my experience here, my experience within Hartford Healthcare. I've been here in my role for about 2 years. Prior to that, I was the regional director of operations for the second largest certified home care agency in Connecticut that also had a small private duty arm of about 100 clients.
Very good. Well, thanks, Michael. Welcome. Does anybody have any questions for Michael?
Michael, are you running the private piece of it?
Yes,
or the private and the certified?
Nope, the private piece.
Okay, I just wasn't clear.
Yep.
Good. Thanks. Thanks, Andrea. Why don't you tell us, Andrea, about Houseworks?
Sure. So Houseworks is a all private home care company. I founded the company over 20 years ago and have been here ever since. We recently made an acquisition in Philadelphia, so one of us has to figure that out. But we started about 20 years ago. We've been really just, I would say about every few years as revenue grew. In the early days, it grew tremendously year over year because we were really one of the first all independent to start. So we had no competition. And if any of you know Boston and Greater Boston now, there's a tremendous, I don't have the 710 number. I have to get that number down, Michael. But I couldn't tell you how many private home care companies there are in Massachusetts, but there's a lot of them. And, but we've been, I would say that over the years, we've built a reputation on really trying to figure out the people and the caregiver piece of it in a way that we haven't really had that many recruitment issues. We work hard at systems. Yeah, and what I was saying before was that it feels like about every couple of years, it's just we're in another startup situation as we spend a lot of time building the infrastructure and building our team and building the marketing and our website and our brand, but and we've done very well. And we recently, I'd say January of 2018, excuse me, and Tony's here on the call with us, brought in a private equity investor because we really wanted to see some expansion. And the expansion is really taking what we're doing in Boston, doing it, continuing to sort of further develop our systems, figure out really the best way to recruit caregivers and maintain them, and create a culture of empowerment of our caregivers, and then growth through both organic growth, acquisition, and within all of that, we're wrapping in technology. And we just yesterday rolled out our tablets. That was really incredible. It was really incredible because the tablets, not only is it going to get information to the office better, what it also does is really empower caregivers. They were really thrilled to be able to use the tablets. So we're kind of wrapping in technology in all of what we're doing, and really thinking about ways to be more invested in value-based relationships. And I would say data is really big on our radar screen now in terms of how to use data both for marketing, but also use data to be able to really create a service delivery that is even better than what we do now. And I would say the other focus is really thinking about specialty services. So we just rolled out a whole dementia suite of services, and we're thinking hard about how to deal with social isolation. So we have a big agenda this year. We are part of, I used to be on the board of NPDA, which is now HCAOA. I was on the board of our Home Care Association in Massachusetts for 8 years and helped them start up the private pay arm for that. So, and on other different boards that aren't as related to the industry, but, you know, really love this industry and think it's just really thrilled about the number of new talented entrants. And I have always been of mind that we can all learn from each other because there's the demand is there. We just have to figure out ways to, you know, really do well by our businesses, but also do well by the industry. So I'll stop there.
Terrific. Thanks, Andrea. And tell me again what your approximate annual revenue is, Andrea.
It's about 20 million. And I would say the other thing I forgot to add was that we also have a small home modification division, which is part of that 20 million. So that reminded me. Thank you.
Okay, great. Thank you. And Michael Nappy, tell me again what you said your revenue was.
Yeah, we're about 12 million.
12 million. Okay, great. Thank you. And Tony, you work with Andrea, is that right? You're muted. There you go.
I do. I joined, as she said, I think she said everything perfectly. I joined in January of 18 as part of, I came from the managed care space. I helped one of the senior officers at a public company, Universal American. We ran Medicare Advantage plans, Medicaid plans, long-term care insurance programs, Medicare ACOs. We were one of the largest Part D prescription plans in the country. But our secret sauce was we were really a care management company that wrapped patients and aligned incentives with providers to, you know, improve quality, keep people healthier, and ultimately keep people out of the hospital, the emergency room, which as the underwriter of that risk would, you know, obviously result in saved costs to the systems. And so we exited that business, my partner and I, about 18 months ago or 2 years ago, when we're looking to enter the home care business because of all the demographics and all the reasons we all love it, and found just what we think is a fabulous platform in Andrea's company. And I've taken on not just an investor hat, but a role helping with strategy and development and sourcing both organic and inorganic growth. So just continuing to try to improve in a rapidly changing environment to make what we all do kind of more efficient and better.
All right, very good. Thanks, Tony. Welcome. Glad you're here. Michael Farina, tell us a little bit about you and what you're doing at Jev's Home Care.
All right. I'm Mike Farina. I started at Jev's Care at Home around November of last year. I came up with two national providers. I worked for Maxim Healthcare for a period of time, and more recently, Bayada Home Healthcare as a division director. And when I was at Bayada, I only worked in the private pay home care field, whereas Maxim, I did all service lines of home care. So I worked in Colorado, New Mexico, Missouri, Florida, Delaware, Maryland, Jersey, now Pennsylvania. So I've been in a lot of different states with the private pay world, but Jev's Care at Home is only in Pennsylvania right now. So our primary office is in Philadelphia. We're about to split that office into two separate offices. And we have a location in Pittsburgh as well. So primarily we were a Medicaid-based company. With my background, we were looking to do more private pay. And, you know, we're changing operations a little bit so that we can go after part of that market. But we're also diversifying in another area that it's not official yet. So I don't want to jinx myself that it won't happen, but we're looking to diversify into other areas of home care as well. Excuse me. And but it's all non-medical right now. We do about 40 million a year, and I think that's it.
Okay, thank you, Michael. Appreciate it. Welcome.
Thanks.
Terry Whittle, you're driving along through Central Florida. Take a moment and tell us a little bit about what you're doing with the private pay division of VNA.
Okay, great. So Visiting Nurse Association of Florida, we have a footprint footprint both on the east and west coasts of Florida, from Port St. Lucie down through Martin County.
Hey, Carrie, can you get just a little bit closer to your phone? We're having a little trouble hearing you.
Sure. Well, okay. I'm so sorry. We do a lot of the east and west coast of Florida, big chunks of Florida. Medicare-based agency, that's our core business, but I run the private side. On the private side, we do VA, we do Medicaid, both PDN and home health aid. We do a lot of private duty, private pay, long-term care insurance. And then we do the care-centric, non-OASIS skilled visits, intermittent visits. I do about 14,000 hours of home health aid, 4,000 hours of skilled nursing, and about 400 skilled visits, and that's per week. That's a good story.
And what's your total revenue going to be, Carrie?
Between 20 and 22 million.
Okay. Terrific. Thank you.
You're welcome.
And from way out west in Montana, Chris Carlson, how are you? Good to see you again. Tell us a little bit about your agency out there.
Yeah, hi there. I'm in Montana. We service the entire state of Montana. So we do that with our 7 locations, bricks and mortar. We're pretty diverse because we need to be in Montana because of the population density. Talking about your areas that you've already mentioned, it sounds pretty dense populated compared to Montana. We have 1 million people. And I was thinking probably somewhere around 100 agencies in total. Mainly there's a top 30 agencies that work together. I'm on the council also for statewide direction of what we do within the regulations of Montana. But the agency that I'm with, I'm the CEO. I've been here 23 years. My parents started the company about 5 years prior to that, since they've retired and passed away. So I've been running the company since I started, and we're Medicaid heavy. We're about 65% Medicaid. We have diversity in services, however. It's the private duty nursing. We call it the EPSTAT program for kiddos that need nursing. VA is the skilled nurse, the home health aid. We're also servicing all of these, what you said, like care management contracts. We do a lot of drug teaching, care management over the phone, in-person visits, contracted through insurance agencies that are, or insurances, carriers that are contracted to provide that higher level managed care, although it's not called that in Montana so much. Let's see, we have about 1,200 clients in any given day. Our budget dollars this year are about 12 million.
Very good. Thank you, Chris. Welcome. Glad you're here. I'm sorry, Andy, I forgot to call on you when Carrie was talking a little bit about, but you're with Carrie at VNA, is that right?
That's correct. That's correct. And I apologize for hopping on the call a little late, but I was going to kind of act as her proxy as I knew she was traveling. But yeah, I cover all of Palm Beach County for the VNA for the private duty side. I mean, a little bit about my background. I also started with Maxim. I was with Maxim for about 6.5 years. I then worked for a large private duty company called Senior Bridge that also focused on care management. Did a short stint with Brookdale, and I've been at the VNA for about 2 years now, a little over 2 years, and just kind of helping Carrie and with support and growing our business lines, across the state.
Very good. Thanks, Andy. Welcome. And from all the way on the West Coast, Greg Hartwell. Greg, welcome. Glad you're here. Tell us a little bit about you and your business.
Hi there. Thank you very much. I'm a little bit under the weather. I seem to have this little bug. I don't know. It's just lingering on for about 11 days now. So my apologies if I start coughing. So we are based in the heart of Silicon Valley. We are literally located in Los Altos, California, which is right in the center of all the Googles and the Facebooks of the world, et cetera. We've been in business for 11 years, and we are 100% private pay. We certainly do a little bit of VA work and obviously take long-term care insurance, but that's primarily private pay. We do about $10 million in revenue, and we really primarily have a single office right there in the middle of the two counties. We have a recruiting office down in San Jose and a small one up in Burlingame, but for the most part, we have a pretty concentrated area. And so, organic growth is probably becoming a little harder to come by. And I think that at the end of the day, that is really, we've got some significant issues in our state and in our area, the Bay Area. As you can imagine, the cost of living is maybe, I don't know, the highest in the country. The unemployment rate is maybe the lowest. So what the government has done at the municipal level is really forced minimum wage. So all of my markets, for the most part, are at $15 an hour. And as you can imagine, that drives everything up. And that's, been compounded like 10 to 20% a year for the past 4 or 5 years, plus overtime after 9 hours in a day. So as you can imagine, the cost of care has risen significantly. So we are facing potentially the first year in which we may have a fewer hours than we had in the previous year. I guess on some level, the good news is our revenues have gone up because our prices have gone up so substantially. But I am seriously concerned about the cost of certainly the live-ins have almost evaporated, and as you can imagine, significant hours of care when you're charging between $30 and $35 an hour plus overtime, it gets very expensive. So we're facing that, and I don't know if that's the reason for the softness. Our turnover and our recruiting is again probably, I am told by people across the country, probably the worst in the nation. And I guess the last component is unionization is on the radar screen. So I don't know if anybody out there is in a state where unionization is taking place, but the SEIU, Service Employees International Union, is now targeted our industry. So that just adds kind of to the overall headache of doing business in California. So that's just a little snapshot of my market.
Okay, very good, Greg. Well, thank you and welcome. So this is our core group. We have another 4 or 5 people who have expressed some interest and have been invited, weren't able to make it today or chose not to, whatever. So we very well could have a couple of more folks joining the group. And then as the group comes together, what I envision is that for those of you who say, yes, I'd like to be part of the group, we'll kick it off with a video conference probably in September and another in October. And then our thought was that we would have our first face-to-face meeting in November. And if that works for everyone, I'll let you tell me what dates work for you or don't work. And Carrie Davies in Stuart, Florida, has agreed to host us in Stuart. If you're not familiar with Stuart, it's on the east coast of Florida, about an hour north of West Palm Beach. And for those of you who live anywhere where there's snow, November in south central eastern Florida will probably be a nice respite. So that's what we're thinking about right now. And then at that meeting, we will set the time and date of our next meeting. So that's our routine, is the last thing we do at each face-to-face meeting is set the time and date and location of the next meeting. What questions do you all have, either for Jill or I, or for other members of the group?
I was just curious about a number of people that your average groups are, participants in each group.
Thanks, Chris. Good question. Typically, we limit membership to 12 companies. And with the larger groups, particularly larger companies, most times people bring 2 people to the meeting. There's a few that bring 1, several brought 3. We're open to that, but we find that having 2 people from a company come together so that you can share ideas and take ideas back and work on them together really pays off, and having the intellectual capacity of multiple people with multiple backgrounds. So that means if we have 10 to 12 companies, we're going to have somewhere around 20 people in each of our face-to-face meetings. And then the video meetings have that potential, although typically not everyone is there for every meeting. So typically we get 60 to 70% of the group each month for the video meetings. Other questions?
Yeah, I'm trying to understand sort of how you facilitate sort of problem solving. So do you have like a theme every meeting? And then if there's a theme, does one of the person who's bringing up the challenge or the success, like sort of talk about it, and then does everybody react to it? Or how does the interchange, the facilitated interchange work? Or am I overthinking it?
No, that's a great question, Andrea. I think that is important. Typically, when we build the agenda for a face-to-face meeting, well, first of all, we usually start with dinner the night before, so we have some social time, get to know each other better, and then we'll kick off. And oftentimes, the first morning is a go around the room. What are the 3 big issues that are getting in the way of you growing your business and achieving your goals? So we identify some of those issues, and then we'll have other agenda items that the group contributes. And let's pick something like caregiver recruiting. And so there's several ways that we might approach that. One, again, would be to go around and ask each person to give us, their 1 or 2 or 3 best practices that have worked for them around caregiver recruiting. And so we have that interchange. And of course, we have the opportunity to ask questions and tap into each other. Other times we will have a member of the group, and this typically happens as the group has been together for a while. A member of the group will maybe contribute an idea, and the group says, I'd like to know more about that. Would the next time, would you come prepared to take an hour and talk about what you're doing on whatever the subject may be? We also often do some leadership learning kinds of things, if the group wants that. And one of my favorite presenters of leadership principles is the woman I live with and sleep with most nights when she's not working with executives. My wife is Elizabeth Jeffries, and she's a nurse by background, but she runs another part of our company called Executive Mastery, and she coaches CEOs and C-suite leaders in hospitals, in major long-term care companies, and she's doing a lot of work right now in academic medicine. Matter of fact, she's in Birmingham, Alabama today with the chairman of the Department of Medicine in the School of Medicine at the University of Alabama at Birmingham. And so oftentimes Elizabeth will do an hour on the second morning on some topic related to executive development and team development. Her book that came out last year is called What Exceptional Executives Need to Know. And so there's oftentimes some learning areas, and oftentimes the group will say, well, I'd like to learn more about executive coaching, or I'd like to learn more about company culture. In some instances, we've had other outside speakers come in and present on specific topics that the group is interested in. So that's sort of the way it goes. And again, as you said, Andrea, I think the key here is each of us brings a wealth of knowledge and experience from our years in the industry. And so a lot of the learning and benefit comes from the exchange of ideas. And I always sort of marvel at the experience when I'm with our top 5% group, because that group has been together since 2012, or at 2013, February 2013 was the first meeting. And the group has changed and there's some new people. But as I see a member who has been with us for 4 or 5 years, and they're talking about some significant thing that they're doing, and I sort of look at the group and you see somebody sort of roll their eyes because it was an idea that they contributed 3 years ago and everybody talked about it, and this person took it and ran with it and added onto it and plussed it and came back and said, here's what I'm doing. And it's really fun to see how ideas come out of a group, people run with it, they add to it, they bring it back, and everybody benefits from that kind of an experience. Other questions? Yeah, somebody spoke. I couldn't see who it was. Oh, I'm sorry. Go ahead. Any other questions, thoughts?
I guess just to follow up on Andrew, so that's the in-person, but in the monthly cadence would be an agenda you would set as a topic, or would be kind of free-flowing? What's on everybody's mind, or what kind of structure would the monthlies take?
That's a great question, Tony. Thank you. Typically, the monthly videos are a single focus topic. And so each group picks the topics that they want to talk about, and we usually have 3 or 4 topics that are in the queue, and we'll say to the group, okay, next month, here are 3 things that you brought up. Which one do you want to talk about? The group says. So, for example, this afternoon, I have our strategic growth mastermind group. That's the group of smallest companies. They're between 1.5 and 3 million. And what they wanted to talk about was a sales system. How do they develop their salespeople? And so I'm going to be doing a presentation on what I call the home care referral source selling system. Sometimes we'll do other topics. Yesterday, we had a whole focus on meetings, and it was about developing cadence and rhythms in your meetings. And so people talked about what meetings they have, and then I shared some of our research on what different people are doing with regard to their meetings and the rhythm and the cadence and the metrics that they use and those kinds of things. So those are typical. One of the groups has decided that they want to take one meeting a quarter and share their financial information and develop their own benchmarks. Of course, we have access. We work closely with Home Care Pulse and the industry benchmarking study, and they give us a special report for companies 5 million and above, and actually they included it in this year's report that they published because they've been giving us special numbers. And so last fall, in the spring, we had all of the companies in all of our mastermind groups fill out some benchmarking information where we created a chart of accounts, and we ask everybody to give us your total revenue and then expenses as a percentage of revenue. And so we have that benchmarking data. And so one of the groups said, well, we want to get a little bit more granular with that, and we want to share our numbers and talk about it once a quarter. So those are the kinds of things that groups want to talk about, and it really will be up to you to decide the issues that are important to you. One of the groups is talking about mergers and acquisitions and exit strategies. How do you value a company? What's it worth? Those kinds of things. So those are the topics. Other questions, suggestions, comments?
Have you, over the last few years, since you have so many groups that are running for such a long time, have you been able to have any metric about sort of success? You know, this is what the group added to the, I mean, is there anything that you've been able to say, because we're part of this group, blah, blah, blah? I mean, and I understand the benefits of a group. I mean, I totally understand. I've been part of these groups before, and I think they have extraordinary value. Just from everything that you said, I'm just curious to know if you've tried to figure out from some of the members what they think, you know, why it's additive, because it's a lot of time and it's money to travel, and it's, you know, just wondering how people approach that in the groups.
Well, I think that's a great question. And what I've seen is that each individual owner or member sort of identifies the value that they get from the group. And of course, we've seen some of the folks who have grown geometrically in size. And some of that has come from what they have learned from other members of the group. Some of it has come from the fact that they're very entrepreneurial, and just being around other entrepreneurial thinkers and leaders, it stimulates what they're doing. Flip
Right.
side of that is we've had some folks, particularly in the smallest group, that have sort of hit that growth ceiling, and they're growing a little bit, but not very much. But they keep coming back, and they keep supporting each other, and they still feel like they're getting value from it. And I think part of that is just being with other people who are in the same business that understand what you're going through, because
Right.
nobody outside of home care really understands it. So I think that's
Got
part
it.
of it as well.
That makes sense.
Yeah.
Thank you.
Yeah. Other thoughts, questions, comments? Well, if you would, let's take a moment, and if you have your calendar handy, if you would just open up your calendar and look at the month of November. And not asking you to make a commitment at this point, but simply to look at November and say, if I were to be a part of this group, when would be a good time for us to have our kickoff meeting? And
I know.
yep,
Sorry.
go ahead.
I know in November that's the Decision Health Conference out in Vegas as well. So I just want to put those dates out there for consideration, because I know I attend that with some of my team. So I think that's November 10th to the 13th. I don't know if anybody else on this attends that.
Thank you, Michael, for letting me know. I know that Decision Health is on there. And occasionally our mastermind groups have met in Las Vegas before or after that conference. This year, nobody's doing that. They're meeting in Tucson before and after the Home Care Association of America conference. But yes, that is a consideration, that if folks are going to Las Vegas, 2 trips in a month, but Florida will be warmer and sunnier than Las Vegas.
When is the HCAOA meeting?
The
Isn't that-
HCLA meeting is September.
Oh, it's September. Oh, I thought it was November.
22nd and 23rd,
Okay,
Sunday, Monday in Tucson, Arizona.
right. And Thanksgiving is the 21st? Wait, oh no. Thanksgiving is the 28th, I guess.
That's correct.
Yes.
Thanksgiving is
Okay.
the 28th. So we block out 10, 11, 12, and we stay away from Thanksgiving, probably Thanksgiving week. And so as we look at dates, the other thing to think about as a group is, what days of the week do you prefer? Typically what groups have done is bumped up their meeting against the weekend, particularly if we're going somewhere nice or somewhere sunny and warm. And so in some instances, we've started on a Sunday evening with a dinner. And again, the dinner is part of your membership. We arrange a nice restaurant. We go somewhere. We usually have a private room. So people can fly in that day, or if you've been there for the weekend, you can enjoy Palm Beach or Stewart or Vero or wherever, and then come for dinner on Sunday evening. We meet all day Monday. People have dinner on their own Monday evening. Tuesday, half a day till noon. You can catch a flight back home. The other approach we've taken is to start with a Wednesday evening dinner. Meet all day Thursday, half a day Friday. People can still get home, or if you want to stay for the weekend. We have one group this year that happens to be meeting on a Tuesday, Wednesday, Thursday, because they decided they didn't want to give up their weekends with their kids, and so they're going to meet during the week. So we're open to any combination of those approaches, and so I'm open to your thoughts. Are you interested in early in the week, later in the week, middle of the week, and is there a week in November that works for us to think about?
Stephen, I have a question. First off, as far as the dates go, beginning, end, or middle of the week, I'm open to whatever. But with the fact that the Private Duty Expo and Thanksgiving being in November, I mean, is it a possibility of doing something in January instead?
It certainly is a possibility. I'd have to ask Carrie about the challenges we will run into with once you get into the season in Florida, January, February, March, you run into 3 issues. One is getting airlines in and out. So if we decide to do that, you got to book your airplane tickets really early. Secondly, hotel rates go way up and meeting space becomes more expensive. But my answer is absolutely yes. If we decide we want to meet in January, we can do that. Carrie, are you still on? I know she was driving.
Or Stephen, how about another consideration? How about October? That's that fall. The HCOA is in September, and then you have the Decision Health in November, and then that leaves October. So I don't know if that's a possibility.
That makes sense. Hey, this is Tony Wolk with Houseworks. Unfortunately, I need to drop off now, but thank you very much. I'll follow up. Thank you.
All right. Thank you, Tony. Appreciate you being
Thank
here.
you.
Bye.
Yes, October is a possibility. We have one group meeting 13th, 14th, and 15th of October in New York State. And I don't see anything else, Jill, to you that would...
8, 9, 10 is in Virginia Beach.
Oh, that's right. Okay. Thank you.
But otherwise,
yeah,
we're open.
So we could certainly do late October if that works better for folks.
There is a leading age conference, the 28th, 9th, and 30th.
October 28, 29, 30.
Yeah.
Okay. And how many are involved in leading age? Just one? Okay. I spoke at that conference last year. I know they have a lot of home care folks there. It was there, were you there last year, Michael? It was in Philadelphia.
No, I wasn't with Jevs at the time, so
Okay.
that wasn't my market.
Yep. Yeah. Okay. Okay. So we've got some other date conflicts in October and November. Any other thoughts about dates that will or won't work for folks?
Maybe you should send around a doodle poll.
Yeah, we can certainly set up a doodle. Jill, do you know how to do doodle?
I do know how to do doodle.
Good.
It's getting him on track with the doodle technology and those kinds of things.
I mean, that's just like when you've got a group like this, I think that sometimes is the easiest. I don't know.
I agree.
Yeah, I agree.
Okay.
Well, this gives us some ideas about that. And so are there any other, in either late October or November, any other conflicts that anybody has that says, no, I absolutely can't make it those dates?
but this is just me, but I'm hosting a fundraiser on the 21st. That's huge. And I gotta be around here.
21st of October?
November. But like, that doesn't mean that somebody on my team couldn't come if you guys decided that, if we decided to join, but that's a limitation for me.
Sure. Well, and this far out, there's no reason that we can't work around that date.
Right.
Yeah, Andrea, absolutely.
Well, maybe you guys can all come. It's all about social isolation.
Oh, okay.
And all you have to do is pay. Sorry.
Hey, go for it.
I got to raise the money, and I hate raising money.
Yeah. Carrie, you were off for a minute, and we were asking about dates in November and October. And then Michael asked about the possibility of January. And I know that on my side of Florida in the winter, hotel rates and meeting space and airline flights are sort of at a premium in season. What's your experience over in Stewart in January? You're on mute. There you go.
Thank you. So PDGM starts January 1st. That would put January really out for us. We're going to be very busy trying to handle the new reimbursement on the Medicare side. The dates in October are fine. Early November, anytime is fine.
Okay.
Great.
Okay. Those not familiar with PDGM, that's the new Medicare reimbursement rate, and Carrie's part, she runs a private pay business, but it's part of a very large home health agency, and so they will be caught up in reimbursement changes.
Yes.
So late October, November. Any other thoughts about either dates that don't work or dates that you said, yay, this would work, let's look at that?
I just have a vacation in October from the 11th through the 20th. It's actually in Florida, just the opposite coast.
Okay. Whereabouts in Florida do you go, Michael?
We're going to Naples.
Okay, good. We like Naples.
A lot.
A lot. my wife and I have a place down in Naples. We're down there.
My parents do as well, so we're going to visit.
Good, good, good.
Nice.
Okay, any other thoughts about dates that do work or don't work? All right, well, let us do this. Let us talk with Carrie and Jill and I and look at 3 or 4 sets of dates that might work for us, and then we'll send out a doodle poll and ask you to pick the ones that will work for you, and based on the dates that everybody can attend or most everybody can attend, we'll put that on the calendar, let you know, and then start working on planning the details of that. Does that work for everyone?
That works.
Yep.
Okay. And if you happen to know of other companies in this size group that don't compete with you, that you think might be a good fit for this group, please let us know, or let them know and ask them to get in touch with us, because we'd like to have, again, eventually this group will fill up at 12 companies, but if we can have our kickoff meeting with 8 or 10 companies, or even 12, that would be great, because I think it'll be a robust discussion, and having a good group of companies to be part of the conversation will really be great. Well, this is a wonderful kickoff. Thank you all for being here. Appreciate it. Anything else for the good of the order this afternoon?
Stephen, just a quick question. In reading through the information on top 6, you said it was pay a half-year dues. Can you just talk a little bit more about that, or what that cost is?
Yeah, the dues starting in the fall will be $5,500 per company, and that covers the 2 face-to-face meetings, the kickoff dinner, the meeting space, the meals, the lunch and breakfast and things that we provide during the meeting, facilitation of the meeting, the AV, all the hard costs of the meeting, and then the 6 or the every month video conferences. And we typically bill those twice a year. So we're typically billed like in the fall and in the spring prior to the face-to-face meeting. And we have an electronic system that does that. We can do a recurring billing on a credit card, or we have a system that will send you an invoice and you can send it into accounts payable.
Okay. So it's $5,500 per year, correct?
Per year, that's correct.
And
as I
that,
said,
does that include, like, if you sent 2 or 3 people?
That's correct.
$5,500 per company, and you get up to, say, 3 people to be able to go.
That's correct. Yes.
As many as you want on the calls every month.
As many as you want to close.
Yeah, many people as you want to have on the video calls, absolutely. Yep. And occasionally we will have special topics where people want to bring somebody from finance or somebody from HR or whatever to a conversation, and you're certainly welcome to do that. Any other questions or anything else for the good of the order?
When did you want to do the next call? Did you want to do August, or did you want to wait till September?
Oh, that's a good question. For those of you who think you might want to be part of this, do you want to kick off our monthly calls in August, or do you want to wait till September?
I vote August.
Yeah, let's just get it going.
All right, sounds good. And typically what we do is hold them on the same day of the month at the same time. And we pick this day at 2 p.m. because it fits in with the other groups that we have. Does this day of the month and time work for everybody? Okay.
Yes.
So we'll get that scheduled 4 weeks from today.
It will
And
be, hold on one second.
okay.
August, that's still July. Sorry, hold on. It would be.
The only thing is that's a Saturday in August.
No, it would be the third Wednesday of every month.
Okay.
Third Wednesday of every month at 2 p.m.
So the
So just-
21st.
So it will be the 21st at 2 p.m. And then the next, September it will be the third Wednesday as well. And I'll send a recurring calendar invite when we're done here. And if you just accept that, even if you can't attend next month, accept it, and then it'll put it on your calendar, from here until eternity, until I. And then monthly you can, decline or accept as well.
And typically what we do is send out a reminder about a week in advance. And then the day or two before the event, we send out an agenda with what we're talking about. If there's any advanced materials, we send those out ahead of time. And then we record each of the video meetings. And then after the meeting, Jill sends out a link with the video recording. So if you weren't able to be there, or if there's somebody else in your group that you want to be able to look at the recording, you can send that link and watch the video. Anything else? Well, it's been great having you all with us today. Thank you so much for giving us an hour of your time, and I hope you'll consider being part of this group. And we will move forward with this and keep it moving. And if there's anything we can do in the meantime to support you, please feel free to reach out and let us know. Thanks so much. Have a great week.
Thank you very much.
Talk to you soon.
Nice to meet everybody.
Bye-bye.
Everybody.
Take care.